Thank you, everyone, for being here. We'll try to share with you some of one well-success project we run at the association. So our mission is to support and empower patients, families and caregivers, raise awareness about NF and contribute somehow to the discovery of a cure for NF by generating this data. So in terms of patient support, we run in present days several projects on the area of education, mental health, speech therapy, some workshops for deaf people, employability and social assistance. We try to run these projects or these lines of support. In terms of education, I would like to share this, what we have done so far. So our association started in 1999. Then the present day board took functions in 2018. And then we established a protocol with the education ministry in Portugal in order to be able to have a teacher full-time with us, working with the families and children. And our first application to this mobility program started in 2020. And this professor, Liliana, she's a patient with NF1. She's a secondary level teacher. She started a year with us and following some families and some children. And at the end of the year, she identified several children with reading difficulties. So the next move we did was to open a specific call to have another teacher, because she had to return to school, to find another teacher that could specifically work on this topic, reading disabilities. So we found Professor Elsa. She's a primary school teacher. So many, like 20 teachers answered the call, but we interviewed all them and selected Professor Elsa. And she did a PhD in human ecology. And she worked during her PhD with this entity, Cães e Livros. It means dogs and books. And we found it very interesting. And in fact, one of the founders of this entity was my colleague in the secondary school. And we established right immediately a connection and a protocol to have this included in our program. Because the idea behind Cães e Livros is to have the presence of a dog as a motivator and a trigger to help children being more relaxed and able to read more easily. We had a gap year with Professor, working, but okay, with Professor Elsa. No, the pointer, sorry. But we kept with Cães e Livros, so these are paid sessions. You will see how much we pay for it. These are paid sessions with a therapist and a dog, so they are a team. Because Professor Elsa had to return to school in this year, the ministry didn't allow any professor to keep on this mobility program. But then we applied again, so we have to apply every year to the ministry to have this teacher with us. We applied with her again and again, and so far we have this teacher for these years, these consecutive years. The limit is for 4 years only in consecutive years. So what we need, what we aim with this education program is to enhance writing and expression skills, encourage ideas, organization and clarity, promote self-confidence and emotional well-being for the children, strengthen communication and reinforce autonomy, and work together, students, teachers and families. So Cães e Livros, as I told you, is a branch from Intermountain Therapy Animals. They run a lot of different programs, and they have this reading education assistant dogs, so the READ program. And several teams can do this training and get authorization from the Intermountain Therapy Animals to run in several other countries this program. So they are certified. Cães e Livros in Portugal, they are certified from the ITA enterprise. And the idea behind is to have the dog, the trained dog that does not judge the child while they are reading, so they get more relaxed. They feel positive empathy and pleasure in reading. Okay, so they kind of get unblocked, and it increases their learning capacity and improves their communication skills, self-esteem, self-control, and confidence. These are our data. We know that in Spain you have these perros e letras here in Spain, and we wonder what is happening in other countries if you have similar teams that could also run this project with our associations and replicate what we have done in Portugal. Some pictures about the team, Professor Elsa, Cristina, and the dog, the team, the therapy and the dog, trained dog. And they go or to the school or to our association headquarters, or even at home, or online. This is all validated to the online scenario. So the dog that is working now in the association is Buddy, a female Épanoel Breton, 4 years old. So we run individual sessions, 20 minutes with the teacher plus 20 minutes with the therapist and the dog, or 40 minutes altogether. It depends on the situation. The dog is well respected, and they don't work in commas more than 4 hours a day. And they do 2 hours in the morning, 2 hours in the afternoon, and then they rest. So for every school year, each children can have 20 sessions scattered around the school year, and it costs to the association something like 22 euros per session. So the families are not paying this. We offer this opportunity, and through the sponsors and the sponsorship we have. Also, we have created other materials and moments to be together. So we have created these bookmarks with the body, some information, and also at the back of the bookmark we added 10 side effects of the reading activity, like discover a passion, boost the creativity, grow the level of vocabulary, focus better on the activities you child can run, get more curious, improve your writing, strengthen your memory, feel calm, think yourself, and swap books with friends. So these are the 10 side effects, secondary side effects of reading and be able to read. We also have a joint meeting together in a special book fair in Lisbon. 2 minutes. And we at the association try and we can really offer a book to each child, and according to their cognitive development and age. So we have these historical records. This school year, we have 14 children enrolled, children and adults running from 3 to 35 years old. We run these sessions in person and online. so the team can go to the school if they have conditions to receive this team, or at the APNF's headquarters. And the children and young adults are scattered around the country, so that's why we need online sessions as well. So we have here in Madeira Island and North, and the most of them are in Lisbon. So we make a survey in the beginning of the year to understand who would like to be enrolled in this program. They apply, the teacher and the therapist apply the REI test, is a test that measures the fluency and the precision of the reading capacity. And they run this test in the beginning and the end of the program. So they measure the velocity of reading and the number of mistakes that the children do in 180 seconds. And it's a test developed by a Portuguese researcher and is applied to, and is validated for the Portuguese population. So the results are fluency improves and they do less mistakes at the end of the year. And what if a child does not cooperate or does not show any improvements? We don't have any case of this. So it's nice. Parents' feedback are very positive as well. And they keep enrolling their children in the program after a year. We have several opportunities to present these results and show this information. And this is running thanks to all the cooperation with some clinics, psychologists, speech therapists, and also from sponsors we got from Alexian and national programs. Thank you very much.